Well, at this point, I've got something else I'd like to know. Because, you see, I'm starting to get a bit worried. Sometimes I forget things, partly because I'm living with someone who forgets things. He's got this disease, so of course I'm scared too. But I realise that I find it difficult to concentrate. I didn't used to be like that. So I'm wondering if these might be very early symptoms of Alzheimer's disease, and whether there's a way of identifying early symptoms.
Ah, I see. Well, look, we all forget things sometimes, of course, because the busier you are and the more things you have to remember, then the more likely you are to forget something. So forgetting things isn't the factor that should set alarm bells ringing, because that's quite common. It's when you forget things more often or more important things. The number of things you forget increases over a few months or years, over 18, 12 or 6 months. You forget things more and more often, or the things get more serious in the sense that you forget things that are particularly important for your life, important for your work, or payments you have to collect or make, weddings, birthdays, and things like that. But both factors have to be involved. Especially the increase in frequency, but also the fact of forgetting significant events.
Now you've said that, I'm getting even more worried, because I have the impression something like that is happening. At this point, if I've got the disease or want to have tests, what do I do?
Well, the first level consists of cognitive tests, which are a series of questions and answers for the objective measurement of memory performance. So they're there to actually quantify or to set a figure on a person's ability to remember things and also other cognitive functions, such as language, coordination, the ability to recognize objects, to plan, and so on and so forth. Because a perceived difficulty in remembering things is not always a real difficulty in remembering and so forth. Because a perceived difficulty in remembering things isn't always a real difficulty in remembering compared to other people of the same age and with the same level of education. Some people demand a lot from themselves. They set very high standards, so they blow up over even a small oversight. Some people demand a lot from themselves. They set very high standards, so they blow even a small oversight right out of all proportion, and they view it as extremely worrying. Then we need to do routine blood tests, which is normal in cases like this, and then if the cognitive assessment shows that your performance is below normal, then it would be possible to go in search of the biomarkers for Alzheimer's disease. Structural, metabolic, biochemical biomarkers by means of an MRI scan, PET scans with glucose marker, and amyloid binding tracers and a spinal tap. However, this is a second step, only recommended if objective cognitive disorders are in fact found.